We'll be touching the judiciary part of gynecology small as we move on. So this is what is known as an informed refusal. So you want to actually do something for me. You told me about the thing, you explained the benefits of the thing, you explained what the side effects of the thing. So to me now, I'll just weigh the thing. Okay, so if I still need that procedure, I'll still tell you go ahead. If I don't want the procedure, yes, you gave me consent, but I refused. That's what is known as informed refusal. So you just have to do it ethical and what legal, counterpart to informed consent. All right. So it refers to what the patient's right to be able to decline what you told them. Yeah. In as much as you have the right to explain the thing, the patient also has the right to decline, and don't feel anyhow when they refuse. Right. So the patient has the right to decline medical treatments after being fully informed of the risks, the benefits, and other options they can go for. So they can decline this one and go for another one. Okay. So this principle is rooted in the respect for the patient's right to actually contribute to decision making, to treating them. So it applies even when the refusal may lead to increased risks of the patient's death. Yes, right. You have to respect them because the life is theirs, not yours. So core principles is patients must receive clear explanations, accurate explanations. Don't twist any information. All right, and relevant information about their condition. So refusal may be voluntarily. Okay, so don't force them, don't pressure them. Clinicians must document the discussion thoroughly because including the risks, and the patient must actually sign. Yes, because sometimes complications might come up and you need to actually vindicate yourself that okay, I put this out to this patient, but it's the patient that actually said no. Right. So patients with decision making capacity has a right to receive refused treatment even during pregnancy, labor, or delivery. Okay. So ethical tensions is what beneficence. So patient may refuse care that clinicians believe is the best. Okay. Maternal and fetal rights. Sometimes fetus does not have the legal personhood, so the mother is taking decisions on the baby. Right. So this issue, this part of what gynecology is not really clear yet. So should you risk the baby because of the mother? Risk perception. So when a clinician sees as unacceptable risks may be acceptable to the patient based. Okay, when a clinician sees unacceptable risks may be accepted to the patient based on their values. Right, so all of that. So common scenarios is labor and delivery. The mother says they don't want cesarean section or episiotomy. Prenatal care. Right, the mother and the family, they are refusing for you to do any genetic screening for the baby. All right, maybe to know if the baby belongs to the man or to know if the baby should have any underlying disease condition. All right, maybe woman is declining pelvic examination, maybe she's shy of the doctor and all of that, contraceptions and all of that. Okay, so clinical responsibilities is don't pressure any patient. Okay, don't withhold any information, advise. You can reason out things, maintain trust, offer alternatives. All right, then continue care. So refusal should not lead to abandonment of the patient. So be friendly with the patient even when they refused. Okay, so that's just for this part of gynecology. All right, and the factors that are involved in it.